Hello, welcome back. If you haven't watched the introduction on the ophthalmic video, I'd recommend you do so, but here's a quick recap. So we're going to focus today on the maxillary branch of the trigeminal nerve. The trigeminal nerve is the fifth cranial nerve, which can be noted in most textbooks as CN for cranial nerve, V for the number 5 in Roman numerals. So the cranial nerve is seen here, outlined in red, and it has 3 branches: the ophthalmic, the maxillary, and the mandibular. These can be noted as V1 for the ophthalmic, V2 for the maxillary, and V3 for the mandibular. The reason they are called this is the V comes from the V for the number 5 of the trigeminal nerve to indicate that it is the trigeminal nerve. The 1, 2, and 3 indicate which branch of the trigeminal nerve the branching nerve is. So in the rest of this video, we're going to talk about the maxillary branch of the trigeminal nerve and the corresponding branches that give sensory supply to the face that come from the maxillary. And as you can see here, we'll say that this is the maxillary branch of the trigeminal. So let's move on to the first branch of the maxillary branch of the trigeminal nerve. So again, I'll just give you a quick summary on what this image is about for the rest of the video. You can see in green up here on this section, we have the ophthalmic branch of the trigeminal nerve, which is V1. Then you can see in this bit, we have the orange branch of the trigeminal, which is in the middle, which we are going to say is the maxillary branch, which is V2. And then in blue, which spans all the way up the temple and down onto the mandible and anterior aspect of the face, we have got the mandibular branch of the trigeminal nerve, which can be noted as V3. Throughout the rest of this video, though, we are only going to be focusing on the mandibular, which is the orange part indicated here. And you can see the trigeminal nerve just in here, highlight that in red, which is tucked away in the cranial cavity. So now we're going to go over one of the branches of the maxillary branch of the trigeminal nerve. We're going to go over the infraorbital nerve. This isn't to be confused with the supraorbital nerve, as this nerve goes to the inferior part of the face and the supraorbital nerve goes superiorly and up to the scalp. So just remember that as we're going through to not get confused between the two. There's quite a lot of things in anatomy have quite similar names, though the infra and the supra should give you an idea of where the nerve is traveling to. So if we take a look here, I'll highlight in purple, the nerve comes through onto the face through the infraorbital foramen. This can be found on the zygomatic area just below the orbit. Now, an important thing to remember, even though this picture is 2D, if you look on the models, all the nerves on the face that we're going to cover are bilateral. So this nerve is also found on the other side of the face. Normally, there is some variation in people, but in this instance, we're going to talk about normal anatomy, so the structures that we will be talking about are bilateral. So looking at the nerve, you can see that the branches descend down to where the lips would be, around where the nose is. So we'll just draw the nose in here in purple where it would be. As in this diagram, we're only showing the ossified structures and the nerves, and because the nose is mainly cartilage, it's obviously not included in the ossified structures. So these branches here go down to the lip, giving labial branches, go to the nasal area here and here, giving off nasal branches, and it also gives off palpebral branches, which gives off to the lower eyelid. So that would be this one here. So as I've already said, it gives off sensory information to the skin of the lower eyelid, just note that it's the lower eyelid, as the supraorbital gives to the upper eyelid. Then it gives off branches to the lateral side of the nose. Well, that's lat side of nose. And then it also gives off part to the movable part of the septum. The septum is the part of the nose, the most medial part of the nose that separates the two nasal cavities. And it also gives branches off to the anterior part of the cheeks. These branches all supply sensory information to the face, which includes touch. And again, I'd like to stress that even though in this diagram it's a 2D structure, these nerves are normally found bilaterally. Now we are onto the zygomaticofacial nerve. Zygomaticofacial nerve is named because it comes from the zygomatic bone, the zygomatic arch, which gives you your cheekbones if you were doing your surface anatomy, and then facial as it supplies sensory innervation to the face. There is a little bit about how nerves are named on each model diagram. If you click on the model section, just at the bottom it has why each nerve of all the branches of the trigeminal nerve are named and where they get their names from. I find it a lot easier to remember structures if I think about its relationship to other structures. So the zygomaticofacial comes out on the zygomatic arch, supplies sensory information to the face. Easy way to remember it. Quite a lot of things in anatomy are like that. And if you are in your spot test and you have no idea what it is, which does happen if the pin is a particular hard thing to pin down, take an educated guess, so look at the structures around it, look at where it's going, look at where it's coming from. Maybe that'll give you a good idea of what the name of it is. It's good to take an educated guess rather than to leave an answer blank. So as I may have already said, for the last nerve, which was the infraorbital, it came through the infraorbital foramen. The zygomatic facial nerve comes through the zygomatic foramen, which you can see is just located here. So just to highlight the nerve that we're actually talking about is this particular one here. And I will highlight in purple. Here is the zygomatic bone. Actually, it might be better in a brighter color. I'll put it in red. So here is the zygomatic bone. Well, the zygomatic arch. And here's the zygomatic foramen. The zygomatic foramen and all the zygomatic arch can all be seen on the 3D models if you go and have a look at that. It's just got the flashcards next to it with all this information written down. So the zygomatic-facial nerve gives sensory information. sensory, and it gives this sensory innervation to the zygomatic arch. So this area, if you touch your own face, you can feel it. It's your cheekbone, just sort of on the superior aspect of your cheeks. And this is where it gives its sensory innervation to. It's interesting to note that this nerve can actually be absent in some individuals. This can be developmental, but it's just a part of variation. And like the infraorbital nerve, if you look on the 3D models, all of these nerves are bilateral, unless of course they are absent, which can happen. The last branch of the maxillary nerve we're going to talk about is the zygomatico-temporal branch. I will highlight that in red for you. It is just here. So again, like the zygomaticofacial nerve, it comes from around the zygomatic arch and goes up superiorly onto your temple. And this is why it's called your zygomatico-temporal nerve. It emerges on the anterior section of the temporal fascia and supplies sensory innervation to the temple above the zygomatic arch. Oh, spelled that wrong. Zygo arch. In the next video on the mandibular branch of the trigeminal nerve, we will go over the auriculotemporal nerve, which is this big blue one. I'll highlight in red again. You can see here. This gives most of the sensory innervation to the temple. So this little nerve, the zygomatico-temporal nerve, gives to the sort of anterior, the most anterior aspect of your temple. Just a quick recap. So we went through the trigeminal branch of the trigeminal maxillary branch. This has got three main nerves: the infraorbital, let's write these down, the zygomatico, facial, and the zygomatico-temporal. This supplies sensory innervation to the middle sort of aspect of your face.